do, if we want to increase flexion, we're going to do a posterior glide. Okay, so you can do that posterior glide at 90 degrees, and posterior glide and posterior distraction are the same. Okay, you can even take the person into more flexion and do that same movement as a posterior glide and as a posterior distraction, okay? With your hands or with the belt, and I'll show you that. But if you have people who have less than 90 degrees, you need to be pressing on the femur with one hand. So,
Timeout. Interesting.
no, Jen, come on. I haven't worked on you in a long time. Your day. Okay. So come onto your back. So if you have somebody who has 90 degrees of hip flexion, as I said, you can do the distraction at 90 degrees. If he has more than that, okay, so okay, so bend this leg up. Okay. So if he has more than 90 degrees, then you can have him go diagonal on the table. You can use the belt or your hands. So go that way. And aim your hip towards the knee. So this would be the 90 degrees, okay? But I can take him to his end range. And now I'm thinking I want to go from anterior femur to posterior femur. So I'm going to angle my force up towards me a little bit. And as he gets more range, I'm going to angle the force even higher, okay? So that here, my force is going that way, and as he gets more range, my force is going more vertical, okay? So you can do that with either the belt or your hands, okay? If he has less than 90 degrees, like let's say this is the end of his range, okay? Then what I want to do essentially is put my hand on the proximal femur and take up the soft tissue slack and glide from anterior femur to posterior femur, okay, that way. Now, I prefer to do this with the leg off the support surface because he could be pushing down, could be doing all kinds of things. So what I might do is just keep him up like this, okay, and just relax and take up the soft tissue slack and then glide from anterior to posterior. If he has less, put him on a roll, let your leg relax. So suppose all he has is like 30 degrees, then I'm coming here again up as high as I can, and then take up the soft tissue slack and glide. You really don't have to stabilize anything. I'm just holding his knee or have a contact here because the femur is not going anyplace. Okay? So that would be in a grid 3, or grade 4, or if you wanted to, you can use a two-handed technique in 3 or 4. Now, you're not gonna feel as much movement as you did at the shoulder, because remember that the shaft of the femur is here, the shaft, the neck, and so you're going through, you don't have your hands directly at the joint line, okay? So when you're pushing here, you're not pushing directly on the head of the femur, okay? So that's anterior glide, posterior glide to increase flexion, okay? If I needed to increase extension, okay, I want to do an anterior glide. Can you come up to your stomach? Now, depending on how much range he's missing, what's normal range for hip extension? 10 to 15 beyond 0, okay? So let's say he doesn't even get to 0, okay? So if he doesn't get to 0, what's he gonna do? He's not gonna be able to lay this way, okay? He would probably let this leg come out to the side and bend your hip a little bit. Yeah, he probably, and let your leg come down. He probably would be in this position, okay? So you don't want him torqued into this position, because that's gonna create a lot of strain at the SI joint and lumbosacral junction and lumbar spine. So you want to put him, pick up your belly and put this pillow on you. So you might put 1 or 2 pillows to accommodate to his flexion contractor, okay? So while he's in this position, what I'm gonna do is put my hand on the posterior femur as high up as I can go, so I'm basically near the gluteal fold, ischial tuberosities. And again, you don't have to stabilize anything here. You can just use a two-hand technique, a lot of soft tissue slack to take up, you know, through all the hamstrings. You okay?
Yep.
And then take up the soft tissue slack and glide into 4s or 3s. Okay? And you can do this, again, you would have him on 2 or 3 pillows if he had a 10, 15, 20 degree hip flexion contraction. Okay? As he gains more range, let's take this pillow out. Now voila, he can lay flat and just slide down so your feet are engaged. Okay, so then I'm going to be in the same place, creating the same glide. Okay. Pick up the soft tissue slack, glide, and 3s and 4s. But I want to get him to more range, okay? So what am I going to do then is take a pillow. If he has neutral now, lift your right leg up. Right leg up. Okay. Okay, and put it down. So now I'm going to take him further into hip extension. Put your hands on and do the same thing. Into grades 4 or 3.
This is if they have greater than neutral, or?
This is, I'm trying, so he got to neutral. Now, I'm going to challenge his ability to get 5 degrees beyond neutral. So I lift up his thigh, and I need to see what happens. He'll go into some hip flexion or a little bit of rotation. So I'm going to make sure he doesn't then increase the glide. If you find that people are going into increased lumbar lordosis, you might want to put a small pillow under there just to neutralize the spine. Okay, because you don't want to get hip extension by lumbar extension. Okay? So, and then you can raise the pillow up even more. Okay, so you might have two pillows under the thigh and one under the belly just to neutralize the spine. Okay?
Is that ever an issue when you're trying to push that you end up just taking a pillow slide?
Not really, if your ankles are right, not so much. If you're really, if you really can't get the lumbar spine, stable, and you are taking a pillow slack, I would try mobilizing from the sideline with the opposite knee bent. Because that will stabilize the spine. Okay, so come onto your back.